Welcome everyone to the Asian Impact webinar, presenting the findings from Indonesia Longitudinal Aging Survey. My name is Aiko Kikkawa, ADB Senior Economist, and I'll be moderating this session. Here, we're delighted to have this opportunity to share findings from the Indonesia Longitudinal Aging Survey 2023, or ILAS. And this is the first survey in Indonesia to provide representative and comprehensive information on the demographic, socioeconomic conditions, health status, and living environment of not only current, but future cohorts of older people. So to unveil the insight from the report, let me introduce Dewa Wisana, Director of Demographic Institute of the University of Indonesia, to take the floor. Dinar, please go ahead.
Okay, thank you very much, Aiko. Just please allow me to share the presentation. Okay, so yes, good day, everyone. And it's a pleasure for me to have you all here today as we present the key findings from the 2023 Indonesia Longitudinal Aging Survey, or we call ILAS. This study is critical in the understanding of aging population in Indonesia, offering evidence to help shape policies that improve their well-being and quality of life. So let's dive into the insight. First, let's look at the demographic breakdown of our respondents or our samples in this survey. The ILAS divides respondents into two main groups: the pre-older, those who are aged 45 to 59 years old, and the older group, aged 60 and above. One notable finding is that most of both groups lives in urban area, following the Indonesians' patterns of urbanizations. However, there is a significant education gap. This has a long-term implication for both economic security as well as the access to services. We also need to be aware of the rising trend of older individuals living alone, which could signal greater social vulnerability in the futures. So the following table on the screen showing off these distributions as well as the patterns so far for this ILAS survey. And next, we also need to understand about health and long-term care needs that the major concerns as we are age. First, the ILAS also examined the prevalence of doctor-diagnosed hypertension and compare to blood pressure reading during the field survey work conducted by our institute. Men in the older age group have tendency to have higher rate of undiagnosed hypertension as shown in this graph. In terms of risky behavior, especially smoking habits, the ILAS also reveal that most of the male respondents are active smokers. This is also following general patterns in Indonesia, where the smoking prevalence among male individuals quite high. Next, we also look at the health screening patterns. Related to the health screenings, there is a perception among older people that screenings aren't necessary, and in terms of access issues such as transportation and financial barriers also play a role on how these elderly groups conducting the health screening that very important for their groups. And then next, we also reveal some informations about these patterns based on the information related to the respondents underwent health screenings in the last year. The ILAS shows that approximately 70% of older people have received the doctor diagnosis for at least one illness. Women in general have tendency to have higher prevalence of the top 3 diagnosed disease compared to men. As can be seen here, most of the females have a higher tendency of the those top 3 diagnosis illnesses among our respondents. So ILAS also gathered some information about ILAS also gathered information about pain reporting and find out that dementia or Alzheimer, stroke, and osteoporosis are the top 3 illness causing limitations in respondents' daily activities. As you can see here, dementia and Alzheimer's consist of 65.8%, while stroke consists of 63.4%, and osteoporosis 63% among the top 3 illness causing limitation in daily activities among our respondents. In terms of diagnosed illness and functional limitation, the ILAS reveal that among the pre-older men who were diagnosed with dementia or Alzheimer's disease, no limitation in daily activities were reported. Here, we also found that more women than men in both pre-older and older groups report all top 3 diseases limiting their activities. Among pre-older men who are diagnosed with dementia or Alzheimer's disease, no limitation in daily activities was reported. Now let's see about the mental health here. Regarding the mental health and cognitive health, the ILAS also found that depression symptoms are more common in the pre-older people and older women. Symptoms of depressions are more prevalent in women, especially in the older group, while cognitive impairment also increase with age. Men in their late 40s are more likely to face cognitive issues than women, but by age 60 and above, women report more cognitive difficulties. So the data from ILAS highlight the need for healthcare services for both the pre-older and older people to prevent the mental and cognitive health issues from worsening. The ILAS also reveals information about nutritional status. Based on Indonesia National Strategy for Aging, the governments have aimed to achieve a reduction in the prevalence of malnutrition to 40% by year 2024. On the other hand, the ILAS found that 44.5% of the older people suffer from malnutrition, a rate that still exceeds the goals outlining in the national strategy. And next, we saw about the activities of daily living or ADLs and instrumental action. About a double burden of malnutrition is evident in older Indonesians. While 15.5% are underweight, obesity rates are also concerning, especially in the pre-order group, where nearly 30% are obese. Interestingly, men tend to be underweight, while women are more likely to be obese. As we can see here, the majority or 82% of older people aged 60 and older are able to fully perform ADLs independently, while 18% require various degrees of assistance with ADLs. Next, it shows about 80% of the older people aged 60 and older can perform independently, while only 11% reported need help in varying degrees. IADL dependency tends to increase as people age, with women having a higher percentage of dependency than men. Independence in daily activities is vital for maintaining dignity and quality of life as we age. Supporting older adults with functional limitation is crucial in this case. Now, let's see about the aged care services. The ILAS reveals that 11.6% of the older people require long-term care services, and this proportion increases with age. The ILAS also gathered information about respondents' perspectives towards special housing or complexes with age-friendly services. Overall, 82% of all respondents aged 45 and older supported the concept of having such special housings or complexes. However, only a small number of respondents were ready or willing to live in special housing or complexes for older people. Now, regarding the older people's caregiver, the ILAS also found that 7.8% of older people do not have a caregiver, and some 2.7% of those in need of long-term care do not have a caregiver. So the profile of older people's caregivers shows that almost all caregivers provided their services without receiving any payment and spend on average 3 to 4 hours per day of routine caregiver. This is quite interesting finding if we want to anticipate how we provide caregiver for almost for all of those older group here in Indonesia. So next, ILAS also asked about the use of technology, apps, and related to any financial inclusions that very important in our economic society. So among many findings that we found in the survey, we found that the older people's futures will be surrounded by technology. The ILAS found that the percentage of people under 60 who can operate digital devices is greater than of the current older people. The survey also reveals that digital literacy among current older people is very low and that the silver divide needs to be bridged. Here, as we can see, the usage of apps in the youngest group is greater than older group, and the low usage could be primarily in urban phenomena, with even low adoptions in rural areas. In terms of financial literacy, the access to digital payment and finance among older people also very low. The proportions of pre-older people who have used smartphone and or the internet for financial transaction in the past year is higher at 16% than the older people. Older men used debit or ATM cards for purchases, payments, or transfer 2 times higher compared than older women. Again, this is quite interesting because we will see how varies the literacy or digital literacy among older people, especially among gender, as well as urban and rural area. Now, let's reveal several key findings on economic and employment aspect of older people. One of the key findings is that income sources shift as people age. For older adults, personal income and government transfers become very crucial. However, transfers from children still make up a significant portion of their income, especially for those respondents aged above 65 years old. So as you can see here, among the respondents aged 45 until 49 years old, the highest source of income come from the house rent. Roughly 25% of the respondents who earn an income were beneficiaries of the government transfers. Pensions account only for around 5% of their total income. Now, this graph actually shows how reliant the older Indonesians are on family support, highlighting the needs for the sustainable financial solutions for aging populations. Transfer from children exceed income from their own personal sources and government transfer combined, especially for older people above 65 years old. As you can see here, the line graph on the bottom that going up slightly bit by the time the respondents age, those are transferred from children, start replacing the role of their own income sources or income from own sources combined with the government transfer that decline from left to right. So this graph also shows about the patterns on government and private transfers as an instrumental system in reducing the gap between consumptions and income among the older people. So the ILAs provide clear evidence that government and private transfer are essential to be able to close this gap. As you can see here, the patterns comparing between the consumptions as well as the income shows a greater gap, between income and expenditures by the time they are getting older, especially after they are age 65 years old. Now, let's see how our elderly group in ILA survey in terms of employment status. Here, we can see that employment rates decline significantly with age. Around 69% of people between 45 and 49 years old are still working, but this drops sharply as we look at the older age group. By the age 80s and above, the employment rate is minimal. This decline is particularly worrisome as many older adults rely on informal job or informal works because they lack pension benefits. The gender gap is also stark. More men are employed than women, and in rural areas, they have higher employment rates than in urban areas. This underlines the need for more inclusive employment policies and social safety nets for older adults. So this is the link where everyone can access and download the report of ILAS 2023. And there are a couple of steps further that we need to go on within these studies. To wrap things up, the ILAS findings provide critical evidence for improving the lives of older Indonesians. Moving forward, our next steps include producing and disseminating the Indonesian version of this report, conducting a policy-relevant research, and creating a data sharing platform. We also plan to explore a second wave of ILAS, which will help us track the changes over time and ensure that our policy responses are based on the latest, most dynamic, and accurate data. That's all for now, and thank you very much for your attention. Back to you, Aiko.
Thank you, Dewa, for exciting and very interesting finding from the ILAS. Of course, this is only specific part of the report, so I really encourage the audience here to download the report and look at the rich content it has. Now, I would like to invite two guest panelists to join the sessions. We have Dinar Kharisma, who's the Senior Policy Planner of Bappenas, replacing Director Tirta Stijo, who could not unfortunately join, and from Bappenas, Ministry of National Development and Planning. We also have Director Cecep Sukria Manstori of Survey Meter. So let me start the question to everyone with this question. In your view, what is the most striking finding from ILAS and why? And let me start with Director Cecep.
Okay, thank you so much, Aiko. The most striking finding in ILAS for me is the access to technology and information. This ILAS study saw the low digital literacy among the older people. According to ILAS, we found that 88% of the older people and 60% of older people have access to information and communication technology. And however, from 60% older people who can access, we find that only 52% of older people can operate a smartphone independently. Another finding is that only 90% of the older people can use applications such as Gojek or Grab, Tokopedia or Shopee, and M-Banking, and only 7% of the older people for purchases, payment, and transfer in the last 12 months. This finding is striking for me for two reasons. First, digital technology information can help older people to get closer to their family, friend, and the neighbor. As we know the pattern of interaction and community life is getting shifted toward digital, with limitation in population mobility and face-to-face interaction, especially with older people. The use of information and communication technology is now becoming increasingly dominant through various platforms and internet network. Thus, this will have implication for the activities of the older person who adopt the change in interaction pattern. And the second, access to the information and communication technology can provide opportunities for the adult people to become more independent in meeting their life needs. Having access to and being able to use digital technology and information will open many paths to information and life support, such as health information. Nowadays, many government programs, assistance, and services are being channeled or delivered through digital application. So having low digital literacy among older persons should also be a concern in the program implementation. From this ILA study, we can see that in the future, older people will increasingly surpass current older people in their ability to use smartphone, tablet, and computer for communication. The capability of future older people to use debit or ATM card, smartphone, and the internet for financial transaction, including access Gojek or Grab, Tokopedia or Shopee or M-Banking, etc., is expected to grow and surpass the ability of current older people. That's all. Thank you.
Thank you, Director Cecep. And indeed, the use of technology has a high gradient by the age, and this is also seen particularly in Indonesia. So let me now start ask the same question. What was the most striking finding, or what was the new findings for you? And I pose this same question to Dinar from Panelist.
Okay, thank you, Aiko. Good afternoon, everyone. I would like to apologize for joining a little bit late, and I would like to apologize as well for Director Tirta that she's not able to come this afternoon. I think I would say that I think it may be bad to say that I'm not surprised, but what I see from ILAs is that we previously we had some indication of some statistics that of course we would like to have, such as the long-term care needs, and also the social and economic well-being of the older people. But unfortunately, we never had such type of data that provide comprehensive information on the situation of the older population. So for now, before ILAs, we basically guess. We basically guess with whatever socioeconomic survey we have, with health survey that we have, to see the vulnerability level of the older population. And now, so recently, a couple of years before ILAs, we have developed what we call as the information system for integrated older people care, and then we get some initial findings on the long-term care needs, and also other information on specific information on older people. And for the long-term care needs, for example, we got a number between 9 to 10% of older people in the location where we did the pilot of the information system to be categorized as older people who are in need of long-term care. And we are surprised to see the result of the ILAs that the number is not too different. The number is actually quite close. And this is a good news for us because we have been basing our policy based on that number because that was the best that we had at that time. So ILAs now is also saying a considerably close number, which is around 11% of those who are in need of long-term care needs. To us, it is not surprising, but it is a relief for us to know that the number is not too far from what we have believed so for now. That will be something that I think a nice surprise to us, and now we can be very confident to say that this is a representative number that we believe representing the situation in Indonesia. I think that's from us, Aiko.
Thank you, Dinar. Now, let me then, I think a lot of the questions we will be also answering at the same time, but the question is about then what can ILAs do what kind of policy implication it has. So I would like to pose this question in a some ordered way. First is about the economic security or the economic well-being of older persons. So similar to our neighbors of the Indonesians, older Indonesians do have limited access to social, the assistance type, or contributory private, or even the private pensions. So I would like to pose this question to Dewa. What does ILAS data tell us about the aspect of economic security, financial preparedness among older person or the new cohort of older person? And what do you see are the necessary policy measures to raise also the financial security of in old age?
Thank you very much, Aiko. So the ILAS data reveals that the economic security and financial preparedness among older people Indonesians remain precarious, with a large proportions of the elderly population lacking access to reliable income sources, such as social, contributory, or private pension. Many older Indonesians continue working well beyond traditional retirement age, often in informal and low-wage sectors. So this reliance on employment in later life, while providing a necessary income sources, expose them to economic risk, particularly as health declines and work opportunities reduce with age. Well, currently Indonesia has made strides in enhancing social protection through various programs like Program Keluarga Harapan or PKH, or sometimes we call it Family Hope programs, as well as our National Health Security Program, which provide conditional cash transfers and universal health coverage. However, these programs are not specifically targeted to address the long-term financial needs of older adults, especially those without savings or pensions. So to raise this financial security in old age, several policy measures could be considered. First, expanding pension coverage. So governments also need to provide policies to broaden pension coverage, especially for informal sector workers. It is crucial. And also introducing flexible voluntary contributory schemes with government matching contributions or subsidies for low-income individuals that could encourage participation in pension system, even among the informal workers. The second policies need to be considered about strengthening the social pensions. A non-contributory social pensions could be established or expanded to provide a basic income floor for older Indonesians who have not contributed to other pensions programs. The third one, probably like we can consider enhancing financial literacy and savings programs, because it will initiate to increase financial literacy among the populations about retirement savings, investments options, and financial planning to prepare their futures cohort for more secure retirements. The fourth, we can propose like gradual integrations of informal sector workers. We are focusing this part that align with the realities of informal work patterns, such as an adaptable contributions schedules, or facilitates this kind of transition from informal to formal job. And last but not least, some policies to be proposed, like integrating existing programs with retirement security objectives. Expanding those cash transfer program, or introducing elements that account for older beneficiaries in long-term economic security could leverage these current programs for broader retirement support. Similarly, adjusting our national health security system to cover more preventive and geriatric care needs would lessen the financial burden on older adults, freeing resources they might otherwise spend on healthcare for other necessities. So by addressing this kind of structural barriers to pension access, expanding social protections, and incentivizing individual financial planning, we hope that Indonesia can enhance the financial security of each aging populations and helping to ensure the older generation are better supported in retirements. Back to you, Aiko.
Yeah, thank you, Dewa, for that more detailed policy proposals, which we would want to consider together with the government. I would like to, I think another sort of advantage or the strength of the ILAs, it's detailed information on the health. So I would like to pose this question to Director Cecep about the more on the health side of the finding. Dewa has already presented some of that, but Director Cecep, what would be the sort of a key policy actions that you feel, or after completing the report, that are needed and needed to be urgently introduced in Indonesia? Director Cecep?
I know that ILAs cover several questions about health status, from physical health, such as subjective health status, fine reporting, illness diagnosed by a doctor, physical measurement, and mental and cognitive health. From ILAS, we find that the poor health is looming both older people and the future cohort of older people that without appropriate prevention and treatment may worsen. For example, hypertension, despite the effort to prevent and treat it, we still see a quite high prevalence of hypertension among current and future cohort older people in ILAS. The prevalence of hypertension among current older people and the future cohort of older people is 27.1%. And this prevalence is based on the doctor diagnosis. When we compare it to the objective measurement, it turns out that the reading is higher than the one diagnosed by a doctor. Is more or less, in the data is 47.1%. This highlight the fact that the hypertension remain largely undiagnosed. So regular checkup are something that need to be encouraged. Care and access to health services for hypertensive patients should be improved and healthy while to lower the risk of developing hypertension, particularly for pre-older people or the future cohort of older people facilitated. The percentage of older people with ADL dependency and needing help with IADL rises with age, and women have a greater increase than men. This is a great significant finding considering the increasing number of older people in the future. We need to prepare for the burden of care, and at the moment, most of the care relies on the family. Policy reform should focus on expanding and enhancing the service to provide long-term care, such home visit, particularly for people without caregiver. ILAS find that 2.7% of older people are currently in need of long-term care, but have no one to take care of them without a caregiver. This is something that we need to focus on. Since 2020 and 2021, we have been working with ADB and Bappenas to develop a community-based long-term care system and services in 5 cities districts in Indonesia. We do hope that this good practice can be scaled up to other regions as well, so that the need of long-term care services can be met. If we talk about gender, women, whether being in the current future cohort of older people, are more likely to experience health issues such as pain, being diagnosed with at least one disease, limitation in activities due to dementia, stroke, osteoporosis, hypertension, or obesity compared to men. From an economic perspective, women have a lower employment rate than men, mostly due to family responsibilities. And if they work, they mostly work in the informal sector, and therefore less opportunity to receive a pension. This really mostly on government subsidized or transfer from children. This is also what we find in ILAs. So they are vulnerable to economic shocks. So policy and program must ensure that access to women to various services, including preventive health services. This can be done by making sure that they have health insurance covered by the government if they are full, to increase their access to health services. Social protection should also cover women in need to prevent poverty, which can lead to the increased risk of poor health and barrier to health care. Back to Aiko. Thank you.
Thank you, Director Cecep. We believe there was some question on the chat box about the gender differences, and I think your comment has highlighted some of that. And indeed, these microdata can really bring a lot of rich information and insight on some of the persisting gender gap as one age. So let me turn to sort of discussing about the more of a strategic use of ILAs, and this is a question to Dinar. So we are aware that, as you said, Bappenas is conducting a socioeconomic registry covering almost all population, including older people. Where does Bappenas see opportunity to leverage this integrate approach used in the ILAs, covering various aspects of socioeconomic well-being, in developing a stronger database for older people? And what would be your strategy to mainstream the usage of data and information in influencing various older people's policy in the country? Do you have any suggestions for, also, we would also want to hear your experience also sharing to other countries. We have quite a number of audiences from outside Indonesia. Thank you, Dina.
Thank you, Aiko. Yeah, I think this is a very good opportunity for us to start having a more complete, comprehensive, and integrated data of Indonesian population, especially older population. So we did the socioeconomic registry, or Exosec, as we call in Indonesia, in 2022, and currently it is, I think, it is the first social registry data that we have that covers more than 90% of Indonesian population. It is very difficult before to have a data that covers all of the older people, because most of the social registry focusing on specific characteristic of the Indonesian population, such as only the poor, only the vulnerable, only students, for example. And this is going to be the first that actually have the largest database of older people in Indonesia. I think about 24 million of older people are recorded in the socioeconomic registry. So what we see the opportunity to even strengthen the socioeconomic registry is that we learn from ILAs what kind of question that we need to have a better policy regarding aging and older people. Because socioeconomic registry is a national registry that covers almost all of the population, it requires a lot of effort to collect the data, and also it affects us in terms of our ability to ask many the number of questions that we can ask in the registry process, and that results into the very limited questions that we could ask about older people as well. So what we want to do next is actually to strengthen the database, starting from the socioeconomic registry. Starting from the socioeconomic registry, we will start to have a pre-list of the older people in Indonesia, and then we plan to develop an integrated older people care that allows community to actually provide and strengthen the service provision for older people, and that will be something that is based on data. Socioeconomic registry can be the pre-list, can be the base of the data, and it can be expanded. It can be made into a more comprehensive set of data. It can be including more variables. And from ILAs, we learn that this is something that is possible to be questioned, to be asked to the older people. And of course, the result will be very beneficial for the government of Indonesia to provide better services for the older population. What we think now is that in the national level, the use of data in policy making is already quite good and well saturated. So having ILAs in the central level is very very time relevant now that we are working on the development of the medium and long-term development plan. And of course, we feel lucky of the support of ADB to have ILAs and to allow us to have a set of information that inspire the whole process of the planning document formulation. However, the situation is not the same with the local government. Not all local government of Indonesia can develop their policy based on data due to lack of a different level of capacity, and also due to the availability of the data. And of course, ILAS is now only representative in the national level, and it's very difficult to take it into the provincial or even city level of Indonesia to be more supportive toward policy making in the provincial and local government level. So having a more expanded socioeconomic registry that also covers additional questions consistent with what have been included in ILAS, that will be a leverage of the data availability of older people for a local government in a various level, even down to a village level. And this is what we dream of. That all level of governments in Indonesia will have enough data for them to conduct policy planning, including data for older people, and that can be very helpful as well for the local level or localities in the community and village level to have data for them to be able to provide better services for the community. I think that would be all from us, Aiko.
Thank you, Dinar. And the use of data at the national levels and at the regional levels certainly differ. So we need sort of a, dialogue, the data set that dialogue each other, but different patterns of information collection that are needed. Yeah. So the use of data for more research will be the advantage of ILAS. We do not have millions of data, but have a compact data, and hopefully we would have a longitudinal, meaning a next round to have even more rigorous data. So this is to Dewa. What kind of research do you see after analyzing the descriptive data, do you think will be beneficial to better understand and inform the policies?
Yes, thank you, Aiko. Like, after examining the baseline of the ILAS data, there are actually a bunch of research questions can be raised up from this. So just to share a couple of the ideas that probably will be very interesting to go further. For example, what factors influence the reliance of older Indonesians on employment versus pensions for income? And how does this vary across regions and socioeconomic groups? So again, because the ILAS also provide the patterns of how the older groups, having works and find a source of income. So we may be able to find out how those kind of informations in relation to specific characteristic to be developed further. Another question is probably related to how effective are existing government programs in improving financial security for the elderly, and what gaps remain for the unprotected groups. That's also another question that need to be dig further, I guess. The other one probably like the impact of health and social support system on the economic security of older individuals, particularly those in informal employment. Again, Indonesia have a lot of informal workers. So this is also need to be anticipated further, and digging further and analyze even more detail about ILAS data, hopefully will share some light to us to understand it even more. The last one probably like how to prepare the current and future cohort of older adults for retirements. one unique features of ILAS, actually, we also already capture the pre-older group. Those who are in the next 10 or 5 to 10 years will enter into the older group. So it will be very beneficial to be able to have the second wave or even the third wave of the survey. And later we can analyze how the transition of different cohorts, different generations of older people able to anticipate their retirements time. So these questions would help to understand the specific vulnerabilities and inform the targeted policy solutions for Indonesia's aging population.
Thank you, Dewa. Let's take, we have about 10 minutes left. So let us take more questions from the audience. So this is perhaps over to you, Dewa. There's a question on the representativeness of the data and also the availability. When would the data be made available? So would you be able to answer that?
Yes, Aiko, and thank you very much for the questions. And yes, we are planning to provide the data for public, so it will be available for public next year around February, if I'm not mistaken. Yeah, so we already developed a systems and a website where people actually can access it. So just keep updating to ADB websites or our websites in Survey Meters or Demographic Institute, University of Indonesia. We will publish about that on how to access the data, and it's free. And regarding the representativeness, so ILAS actually cover the 9 provinces in each islands or each regions in Indonesia. So as also Dinar mentioned, the representativeness actually it's on for the whole nations, for Indonesia wide. Those 9 provinces that survey in our coverage here, actually representing already the most the province with most aging population. So those who are already have more than 10% aging population in those provinces, it's the target of our survey. So if we want to analysis even at lower level than the national one, we can do in the regional or islands based. Sumatra have their own representative, Java have their own representativeness, Kalimantan or the Borneo Island also representativeness, and the eastern part of Indonesia also covered by several provinces. So yeah, I guess that's my response, Aiko. Thank you very much for the questions.
Thank you. Thank you. And this is maybe the question to Director Cecep. So we have some questions here about a country who are interested in conducting similar studies. Can you share, and the Survey Meter led the survey itself with of course, a good experience from previous surveys and expertise from the household survey. Can you tell us a little bit, very briefly, about your experience, the challenges you faced, or the methodological issue that you have tackled to realize this ILAS?
The first thing that we have to consider to do to start the survey is about how to do the household listing. In this first round of longitudinal aging survey, we had to conduct a household listing. This is very important activity in a study to prepare a sampling frame. The list was created to identify the target household in the sampling area. When conducting listing in urban and in rural area where boundary were unclear, our listing team should accompany or guided by the head of the neighbor or a local community leader or local youth to make sure that all eligible households have been recorded in our listing form. And the second is about the questionnaire. So we have to make the questionnaire comprehensive, and we have to design to taking account with the similar with the other survey. In class, we make similarity with the first and the second wave of Malaysia Aging and Retirement Survey, and also we conduct with the similarity with the Indonesian Family Lab Survey, and as well as now the new question used to answer the current condition of other Indonesia. However, not all the additional question from stakeholder could be accommodated due to the time and cost constraints. So we have to consider time and cost constraint, taking the compromise solution by including questions that are comparable to other survey, addressing some stakeholder input. And then we also consider about the location in Indonesia. Indonesia is archipelago, and ILAs we conduct ILAs in 9 provinces with a spread approach in from Sumatera to Maluku. This condition had an impact on a quite large of the cohort. We have to design to create the team locally for efficiency the cost. And then again for the, maybe this is for Indonesia, the language. Indonesia has a bahasa, but we have also has a local language. And I was thinking that ILAS respondent is older people, so most of whom could not speak bahasa, and some did not have Indonesia speaking compromise. This condition required some team member to master the local language, and some of the member were from the local area to speak and local language. I think that's all. Back to Aiko. Thank you, Aiko.
Yeah, thank you, Director Cecep. The survey meter took very careful approach to enumerating, developing the questionnaire, testing questionnaire. So it went, a lot of work went into published this report. So I would like to thank all the panelists and also the audience for joining this seminar. And there are some more questions actually on whether there are other countries who are doing similar surveys or data is available. ADB and many other international organizations are actually supporting these initiatives, and that we have recently published a report called Aging Well in Asia, which lists availability of this database and so on. So please, if you have opportunity, take a look to those reports to have more information on it. So again, I would like to thank all the panelists and the audience for joining. And before closing today's webinar, we would like to invite you to join our next Asian Impact webinar, which is on designing competition policy for economic development. And this will be held on 27th of November, a Wednesday from 8:30 to 9:30 Manila time. So please do check our website, the Asian Impact webinar website, Chief Economics X account for more update. So thank you and see you again.